Hello friends, welcome back. So in today's talk, let us see what are the causes for chronic lifestyle disorders or increased aging or senescence in an individual. And why do we have to look into the cause of these problems? So what do we basically mean by a chronic lifestyle problem, or what is meant by increased aging? So this means that there are particular changes in the physical framework or mental framework of the individual, which is decreasing the functional capacities of that individual, which is causing a decreased mobility, decreased communication skill, or making the individual more dependent to sustain his day-to-day activities. So this is the effect of any chronic ailment or aging on an individual, for which we need to look into a solution. What can be done to undo these changes, and how can the functional capacity, the independence, and the communication and the well-being of that individual can be restored. So now moving forward into the cause. Before entering or before going into any particular cause of chronic lifestyle disorder or senescence, we need to understand and we need to remove the confusion of levels in medical science. And before labeling any particular cause as the root cause for an ailment, this level confusion needs to be understood. What do we mean by level confusion, and what is the particular cause on which level, and whether the cause that is applying or that is happening on a particular level is causing the effect on the same level, or it is causing the effect on other levels. So suppose we are seeing that there are some functional alteration, physical alterations in an individual. Physical alterations in an individual means that the blood pressure is going up, the functional capacity, the oxygen saturation levels are going down, stamina is going down, or the blood sugar levels are getting disturbed, or there is any anatomical problem that is happening in the particular individual. In that is a chronic problem. We are only applying this to the scenario of chronic health disorders right now. So what do we understand by the allopathic medical science is that go to the cause, go to the cause. And where is allopathic science going to is that if you are having a physical problem, look for the cause in at a level that is deeper or before the physical. That means that generally from the physical or the macroscopic organism, the visible organism, to find out the cause, the allopathic science is moving one step further and going to the microscopic level. So in this microscopic level, what are the things that are altering the physical framework of the individual and causing the disease? On this level, the medical science says that the cause is in the inflammatory markers that are increasing in the individual, the alterations in the hormones, the alterations in the neurotransmitters, So they are moving towards the biochemical part of the individual to answer that there is a physical problem. At this level, most of the diseases of the chronic disorders are dealt in allopathic science. Let it be all the psychiatric disorders, neurological disorders, they are aiming at restoring this imbalance that is happening at the neurotransmitter, hormonal, or biochemical level. So, if insulin is responsible for diabetes, insulin is a compound, is a chemical that is on a subcellular level, right? You can't see insulin physically. So, it is altering the insulin levels to restore the physical. If it is any of the psychiatric problems, let it be depression, anxiety, or anything, it is altering the serotonin or adrenaline, noradrenaline, dopamine levels, the neurotransmitters, to restore the balance on the next level. So it is altering, or it is changing, or setting in balance at a level before to adjust the level that is further ahead. All right. So this we have understood about two levels. One is the physical, where the problem is manifesting, and the microscopic or the cellular or the biochemical level, where the medical science is playing around to set the balance right so that the physical can be balanced. Case of hypertension, it is fiddling around with renin, angiotensin levels, adrenaline, noradrenaline levels, calcium levels, so that the blood vessels are dilated, they are not constricted, and other factors to increase the output of water or salt from the body. So all these things are taking place by altering the chemical components or the chemical area of the system, the body. So this we have understood two levels. At the physical level, some problem happened, we try to adjust the chemical level. Now if we look at the problem at the chemical level, we leave the physical apart and we are moving a step further or step before or deeper or towards the root cause of that. So now we are not concerned with the physical, we are seeing the chemical disturbances that has happened. Now applying the law, the chemical disturbances that has happened cannot be dealt at the level where the chemical disturbance is happening. For that we have to move a step further. Now what is the step before the chemical levels are getting disturbed or altered? Now here we move into the level of thoughts and emotions. So previously we were at the gross level, the physical, then we moved on the microscopic or the subcellular levels or the domain of the neurotransmitters, chemical messengers. Now we are moving a step further or a step deeper to address that into an area which cannot be seen either under the microscope or it can't be seen directly, right? So the thoughts and emotions are affecting the chemicals which are affecting the physical. So this is the level where they say that all the chronic lifestyle disorders are related to stress or lifestyle problems. So what do we mean by lifestyle problems? What do we mean by lifestyle problems? the way in which we are trying to address the lifestyle problems are diet, exercise, mental well-being, social connections, risk avoiding the risky behaviors, leaving the addictions. These are some of the areas or the pillars of the lifestyle medicine. So what is meant by this area of lifestyle medicine is that all these things are dependent on the particular choice the individual is making. And how do we make the choice? We make the choice through thoughts and emotions. Where we find pleasure, our thoughts are directed to achieve that pleasure. So, our lifestyle choices are directed from the mental realm. Now we see, and any disturbance that is happening here in the mental and emotional, we say that is a stress. That is stress means that is conflict, and that is unduly, unnecessarily consuming your energy and depleting you of energy. So now there are few sciences, like suppose we talk about homeopathy science. So in homeopathy, the medicines are not only taking into consideration the physical problems that the individual is happening, but it is also looking into the mental, the thought process, emotional levels, and other things. So it is a little bit deeper in assessing the problem compared to the allopathic science. All right. So that means that if we are doing anything here in the mental realm, the cause should be taken care of and the effect should be cured. But this is not happening. Why? Because the problem that is happening in the mental level cannot be tackled by adjusting the mental level. For that, we have to move a step further or a step deeper within. Now, what is this step from where we are? I am not talking about how to deal with the problem. We already have lot of sciences and lot of modalities to deal with the problems at either the physical level or the biochemical level or the mental level. We are concerned about the cure of the problem. So now if we say that we have to address the root cause of the problem, the root cause of the problem is not inflammation, it is not immunity. We have seen that is much lower in the rung. It is at the level of the chemicals and the neurotransmitters and the biochemical level. So addressing the stress, relieve stress, stress management, and all these things, we are trying to only address the problem at the level of the same level where the mental is. So for the cure of the mental, we have to move a step further or a step deeper within. And what is that step? That step is what is moving into the mental. We have seen that mental is moving in the biochemical, biochemical is moving into the physical. So moving back from the physical to biochemical to the mental, what is moving in the mental? It is consciousness, awareness, your attention. Attention is moving into, or you can call it energy. Attention is moving into how do you choose a thought? What is choosing the thought? The attention is choosing the thought. The attention is moving in a direction, and that we say that this is a particular choice that has been made. By whom? By the attention. The attention is moving there. So anything, anything that is working at the level of attention is working at the root cause of the problem. And anything working at the level of attention or awareness is known as spiritual well-being. So the mental well-being, the physical well-being, everything springs out of spiritual well-being. So this is the level where we have to work in if we are really concerned about the cure of the problem. And anything that is moving in the realm of thoughts, we are meditating, we are doing breath counting, we are doing this, anything, we are moving in the mental realm only here. So what means to be in attention? What means to be in awareness? What means the moment we say that attention is moving away from thoughts? What is meant by this disengagement of attention from the mental? This is spiritual well-being. That is the reason that so many patients come to us and say that we have been following a particular set of lifestyle, we have been doing good exercises, we are eating well, we are sleeping on time, everything is following on time, but the problem is not reversing. Why is that happening? Because they are to the level these things can alter the physical, can alter the biochemical, because it is altering the mental. Up to that level, that person is getting the benefit. Subsequently, he might be following a very good regime, but if his mental is going to the previous patterns, the problem or the resolution will not be a sustainable resolution. That is why in diabetes reversal, the term that the ADA and the governing bodies are more interested in using is remission. What in the chronic problems, the term they use is remission, because the patient has a propensity to fall back into the same old patterns, so the disease might come back. And if it is dealt at the deeper level or the root cause, then only the disease can be cured. I hope this was helpful. We'll continue with particular causes in subsequent videos. Thank you for your attention.